And we're getting answers after a North Highlands family battling the coronavirus reached out to us saying conditions at UC Davis Medical Center were, in their words, disappointing.
Oh, it makes me angry. It makes me very angry.
Shelly Peters and her entire family now battling the coronavirus. But it's her 25-year-old daughter who suffers from asthma who's now hospitalized in one of these overflow rooms.
Bare walls, a shower curtain that didn't even completely close where she could have privacy to use the commode next to her bed. And she'd say, "Mom, it's been hours. I haven't seen anybody for hours." Now, you have somebody in crisis with oxygen levels and COVID pneumonia. Why are you leaving them alone for hours?
Mom says her daughter spent up to 30 hours staring up at this open ceiling with exposed pipes and ductwork.
It's very challenging to have a child there that, I know she's an adult child and people are not going to understand that, but she's still my family, my baby.
UC Davis Health released this statement saying we provide the highest quality and compassionate care to all patients as we continue to manage more than twice the number of COVID-19 patients today as we had at this time last year.
No patient should have to go into that basement room and face the inability to get to a restroom if they need it, or have to holler for a nurse and not have enough oxygen to yell because they're not giving a call button.
Shelly admits the family is not vaccinated, but says they are still doing their research. Meanwhile, a UC Davis patient relations analyst released this apology to the family and says the emergency department leadership is now reviewing this case as Irene continues her battle against the virus.
To not be able to be there to take care of her is impossible. It's killing all of us.
ABC 10 wanted to learn more about that overflow space, and so UC Davis tells us while some hospitals set up outdoor tents and place beds and parking garages for overflow space, UC Davis Medical Center has been able to use a specially prepared section inside the hospital next to the emergency department to accommodate a growing number of patients. The space exists precisely for situations such as the coronavirus surge. This treatment area is separate from the rest of the hospital beds, has its own air supply, and can be reconfigured easily to meet patient care needs. And it has been inspected and approved multiple times by state regulators.